welcome to Findings, the National Security and Intelligence video vlog. This morning, we're going to talk a little bit about your health data. That's a question that's probably on everybody's minds these days. And I want you to start out by kind of doing a little thought experiment. Here's a question for you. If it turned out that somebody that you had been going to the office and working with was diagnosed with a disease like COVID, do you feel like you have a right to know that information? Should that person be legally required in some way to share that information with you? How about if it's just somebody at your building, not necessarily in your office? How about if it's someone in your neighborhood? Generally, we think of health information as private, don't we? But when we begin to talk about something like a pandemic and we begin to talk about a disease that's potentially fatal, I think all of us, it's sort of natural self-interest to think a little differently about this question of health data intelligence. And we've been seeing some very interesting things going on in the fields of health data surveillance and health data intelligence, really since the beginning of 2020. And today I want to talk about two things. I want to talk about the ways in which data can be used to predict disease outbreaks, and also the ways in which data can be used to monitor citizen behavior in the areas of health security protection. For many years now, analysts have been looking at how people behave in order to predict where a disease outbreak is likely to occur. Many of us have heard of something called the Google Flu Map, which has been going on for many, many years. People go online often if they think they might have the flu in the winter in particular, and they kind of type in their symptoms. I've got a cold, I've got a sore throat. And the folks at Google figured out that if you could see where people were searching those symptoms, you might be pretty good at predicting where the flu was going to break out. So that was one of the earliest uses of this kind of health data to make predictions about health. And most famously, recently in the COVID epidemic, there's a company called Blue Dot in Silicon Valley. And that company predicted which countries were going to have the first outbreaks of COVID once it had been identified in Wuhan in China. And what they did is they looked at airline data, who was getting on a plane in Wuhan and where they were getting off that plane. This data was being provided to them by airline companies, and this data was anonymous. That is, they didn't know who was getting off the plane. They couldn't, tie that specifically to you. They just knew what the patterns of ticket purchasing were. And furthermore, since this analysis was all being done by AI, you could argue that, well, no one was actually really looking at your data. There were no humans involved in kind of carrying out those calculations. And the questions are really, currently airlines are kind of voluntarily sharing this information, but at some point should they be mandated to share this information? And if so, with who? With private companies, with the government, and what sorts of dangers are associated with that? And I just want to kind of break out here. This is different from, for example, the CIA getting permission to look at specific, I guess they call them a flight manifest, a roster, looking at specific airline purchases of people like on watch lists, like suspected terrorists. So what's interesting here is if you think about people looking at this aggregate data about everybody getting on the plane and everybody getting off the plane, in a sense, everyone who's on that plane isn't a potential terrorist, but they are a potential disease vector. In that sense, we are all potential disease vectors. We're all kind of allied with this invisible enemy, this virus. So that's one way that your health information is kind of being compiled and collected and used for purposes of prediction. But the other kind of interesting trend that we're seeing these days, the ways in which data can be used to monitor citizen behavior, such as whether people are complying with curfews, shelter-in-place orders, whether or not people are still going to the beach, whether or not they're still going to national parks, whether they're congregating in larger groups than this 8 to 10, which is recommended. And here we begin to get into this issue of medical data privacy. At least in the United States, we've traditionally had pretty strict data privacy laws regarding our medical data. The HIPAA, the Health Information Portability and Accountability Act, has been around since 1996, and you're probably familiar with that. It means you have control over who can see and access your private health information. If you go to the doctor's office, you've probably signed a HIPAA waiver at some point, allowing a family member, for example, if they pick up your phone, they can still hear your test results. You've given them permission to have access to that health information. But the question that we now need to think about is, in a national emergency, and particularly in a national or even an international health emergency, where our health data, like a diagnosis, becomes a matter of national security, should existing privacy laws still apply, or should they be modified in some way? Is the top value to be pursued sort of the protection of your personal health information privacy? A reporter on a blog I was reading this morning talked about working in Wuhan, and he noticed that there was a sign in his apartment building saying that someone in his apartment building had been diagnosed with COVID, but it didn't say who. But should you be told, as I asked, if someone in your office has COVID, if someone on, the military installation where you're working? And so the idea that if you have a disease which is potentially a threat to other people, maybe we're going to break some of this information privacy is not really a new idea. Public health has always had laws about certain types of communicable diseases. If, for example, you're diagnosed with tuberculosis, your doctor may ask you who else you are regularly in contact with. And in that situation, those people might be contacted by the health department and that health information waived. But there's some interesting conversations going on right now. There's been this idea that maybe if you can get an antibody test and it turns out you already had COVID, some people think that means you're going to be immune. You have an antibody which kind of fights against COVID, and a lot of people believe you can't get it again. And so some people have said, well, if people have had COVID and recovered, are not contagious and possibly immune, you could give them some kind of document they could show, their immunity passport. And the question is, would people who don't have that immunity, who don't have that passport, then be stigmatized? And who could demand to see your immunity passport? Could you be told that you can't get on a plane or stay at somebody's Airbnb or a hotel without it? There's also a discussion about new regulations, things like the use of infrared cameras, which might identify who might be hot with the virus, systems for taking your temperature when you arrive at a border or at your workplace. And many of you who around here who work at military installations, I understand your temperatures are already being taken when you report for work in the morning. So this is already starting to be implemented. But we're also looking at the development of potentially more invasive technologies, something like an app on your phone that keeps track of who you're in contact with regularly. And the question is, if you found out you had COVID, who then should have access to that data? Should it be kind of imperative upon you to contact people and tell them you have COVID, or could you decide not to do that? Should your phone then be given over to the health department and they make that decision? And what we want to think about here over the long terms, kind of once we get through this crisis, then what comes next is, what are the dangers associated with producing and disseminating this data? And I think for political scientists, at least for me, the example of COVID monitoring illustrates two issues of interest. The first is this notion, and if you've taken any classes with me, you've heard this term before, emerging technologies, issues where a technology kind of gets created so quickly with kind of long-ranging ramifications in social, economic, political realms. The problem is that often regulation lags really far behind. We don't have a specific set of regulations about this social contact monitoring and tracing because it's relatively new. The second kind of issue we want to talk about, and if you've taken a course with me, you've probably heard me talk about this before too, is what the Italian political analyst Georgi Agamben calls the politics of the emergency. And famously, he argued that after 9/11, governments were able to become much more involved and invasive in people's lives because it seemed like objecting to government overreach made you kind of potentially suspect. You were kind of seen as unpatriotic if you were calling out or questioning kind of government having access to, your mail or your email or something like that. He recently became the subject of controversy in Italy, his home country, when he suggested that states might be tempted to use the public health emergency to act in more far-reaching ways in the areas of data privacy. And so this allows us to ask, are we really all in this together? Do we all have the same interests in this emergency? And what might be the long-range implications of this health emergency? And today we have people asking if the emergency is even real, right? We have some of these demonstrations. And so hopefully what you've seen this morning is that kind of politics of public health are really interesting, and you really want to take my course in Session C on health and national security after this little teaser. And also, I think you see that health policy isn't necessarily, it's kind of both unique and not unique when we talk about national security issues. So a lot more to dive into, a lot more fun to be had. And hopefully I'll see some of you in my class in Session C. Thank you.